Now we'll start today's topics, enzyme. And today's topic is enzyme kinetics and mechanism of enzyme action. You have already you had a class on enzyme. There you were taught what is enzyme, what is classification, active sites, and all these things you have been cofactors. These are taught. So I will teach you today enzyme kinetics and mechanism of enzyme action. So what is an enzyme? Anybody who can tell what is enzyme? See, enzyme is a very important molecule for the living cell. For the living cell, it is very important. Without enzyme, you cannot live for a second even. Is not it? And enzyme is equally important for your exam. There will be definitely some question from enzyme, and that is long answer type of question, short notes, what not. Everything will be there. Explain why. All these things are there in enzyme. So definition. Anybody? Tell me.
So enzymes are proteins, mechanisms to break down substances.
Now enzymes are biocatalysts. Okay? Synthesized by the living cell. They are CTPS, just to remember, CTPS. Okay? They are colloidal in nature, as because they are protein, on solution they produce colloid. So they are colloidal in nature, they are thermolabile. Okay? If the heat is applied beyond the its activity limit, as it is a protein, it will get destroyed. It will lose its function. Okay? So it's a protein. And specific in action. The enzyme will act only on its substrate. So millions of enzymes is there in the body, and each moment millions of enzyme reactions being catalyzed, and there is no overlapping of activity, enzyme activity, because of the specification of its action. Okay? So classification part you have known already. So we will not now factors affecting enzyme concept activity. Now enzyme kinetics. Kinetics, the word as such related to the velocity. So enzyme kinetics is nothing but the velocity of enzyme action. Okay? Now velocity of enzyme action is affected by these factors: concentration of enzyme, then substrate concentration, then effect of temperature. With the change of temperature, the activity of the enzyme changes. Then effect of pH. With the change of pH, the activity of the enzyme changes. Can you see the board, this one? Last bench? Okay. Then effect of product concentration, effect of activator, radiation, light. Now, one by one we will explain. Effect of enzyme concentration. The effect of velocity of enzyme activity is directly proportional to the concentration of enzyme. Concentration of enzyme. And we write this way, this is the molar concentration of the enzyme. And we write this way, this is the molar concentration of substrate. Okay. Now it has been found that velocity of the enzyme action is directly proportional with the concentration of the enzyme in the solution. Velocity of reaction is measured to determine serum enzyme for diagnosis of disease. Now, velocity of enzyme action is proportional to the concentration of enzyme. That means when the enzyme acts, the product is produced. Okay? So we measure the concentration of product rise of product concentration in a unit time. So from that we calculate the how much enzyme is present in the solution. We use for this a known volume of serum and keep all the other factors, substrate concentration, pH, temperature at optimum level to assay the enzyme. Now, effect of substrate concentration. The enzyme activity is proportionally increased with the concentration of substrate. But if we go on increasing the substrate, the enzyme activity after a certain times, it does not increase as to what we expect. Now this is a so if we make a graph, this is a x-axis. Here it is substrate concentration, it is velocity of the enzyme. So when we increase the substrate concentration, it usually increases like this, and after a while the rise of the graph is very slow. Okay? Virtually, if we go on increasing the substrate up to unlimited limit, amount, this line never touches the maximum velocity. This is the line of maximum velocity. There is always a gap. V max, it is called maximum velocity. Okay? Now, in the beginning, it looks like proportional, but after sometimes it becomes curved and it becomes horizontal. A hyperbolic curve is produced due to saturation of the enzyme present. So we have put some enzyme and we are adding the substrate. At times, all the enzymes will be bound to the substrate and no more enzyme activity will be increased even after further addition of the substrate because of the exhaustion of the enzyme. So in the beginning, just see, as if it is like a proportionality increase. Okay. Now, if we increase little bit of substrate, it will increase like that. So in the beginning, there is an increase of enzyme activity almost proportional to the substrate concentration. This is called first order enzyme activity, first order enzyme kinetics. And in the last part, it becomes almost zero. Even after addition of the more substrate, the enzyme activity is not increased that much. So this type of activity is called zero order kinetics. Now on this enzyme velocity, two scientists, they work extensively. Michaelis-Menten, Leonor Michaelis and Menten. So they proposed that a formula enzyme plus substrate produces enzyme-substrate complex, and after a catalysis they produce enzyme and product. That means product is released, enzyme gets separated. Okay. Now this K is the reaction constant, and ES means enzyme substrate complex is also called Michaelis-Menten complex. Now if we skip this middle part, enzyme plus substrate, enzyme plus product. So here the constant is Km. This Km is nothing but the Michaelis-Menten constant. It is in the name of those two scientists. Now what is this Km? Km is K2 plus K3 divided by K1. This forward reaction and opposite reaction, they are added, and this one K1 is kept in the divided by K1. Now they said that to determine the velocity of the enzyme action, they have given a formula: initial velocity. In some book it is written V0. It is the initial velocity is equal to Vmax into substrate concentration divided by Km plus substrate concentration. This formula has been given by the Michaelis-Menten. They have proposed this formula. So in this formula, V is the initial velocity, Vmax is the maximum velocity of the enzyme, S substrate concentration, molar concentration, and Km is the Michaelis-Menten constant. Okay. So from this formula, we can derive what is the velocity of the enzyme. Now, in the previous graph, you have seen that in the beginning, there is a proportionate rise of the curve. So, what we do? Let's replace this velocity with half of the velocity of enzyme. Half the velocity of enzyme. That means half into Vmax. Half Vmax. So let's see what is Km. What is the value of Km? Let's see. So here we replace it, half Vmax is equal to Vmax half Vmax you come here this side. Now we will bring this K this side. Km is equal to Vmax will be cancelled. Km is equal to US minus S is equal to S. So, in half of the maximum velocity, the Km equal to substrate concentration. Okay, that means in vice versa, half of the substrate concentration, the half of the maximum velocity is obtained for a particular enzyme. So from this several conclusion we can get Km at half, Km is equal to substrate concentration in a when the velocity is half of the maximum velocity. Okay. Now, enzyme is having lower Km value, has higher affinity between enzyme and substrate. Let's see what is there. So, say one type of enzyme, one enzyme is E1, another enzyme is E2, and their maximum velocity for calculation purpose, let's take it is 100. It is 100. Now this has a Km value of K10 and this one has a Km value of K20. Okay. Now half of the maximum velocity is 50. So it is, we will write 50 here. Now to produce this 50, half of the maximum velocity, the enzyme having Km10 is having substrate concentration of what? 10 only. Because at half maximum velocity, the substrate concentration is equal to the Km value. No? For this one, it is 20. So, we can easily see less amount of substrate can produce half maximum velocity in case of enzyme E1, and in case of enzyme E2, it requires 20 substrate concentration to produce 50%, half of the maximum velocity. That implies enzyme having less Km value has more affinity towards the substrate. Okay? And enzyme having higher Km value has less affinity towards the substrate. So, this is the number B. And next is this Km value. It is fixed for particular enzyme. It is a signature of the enzyme. It is constant and characteristic feature of a given enzyme. Km value, it is not changed if the substrate concentration is increased or if the enzyme concentration is increased. Now, one thing from this equation and from the previous graph, we cannot determine the maximum velocity of the enzyme because we have half max velocity, we have given here 50. So if we double this, then it cannot be 100. We have, for the calculation sake, we have taken 100, but when an enzyme half maximum velocity is 50, now we cannot say that its maximum velocity is 100 because the curve has hyperbolic ingression, no? It is like that. So what we have found here is not true for here. Understood, no? So that's why they have suggested another formula by which we can determine the maximum velocity of the enzyme. That is called Lineweaver-Burk double reciprocal plot. In that case, everything is taken its reciprocal only. Here 1 by Vmax out instead of Vmax, here 1 by substrate concentration instead of so on. So when like that, after the equation, you see we have calculated it, and lastly 1 by V is equal to Km by Vmax into substrate concentration plus 1 by Vmax. Okay? Now it is a constant replaced by A, it is a constant replaced by B. Now the formula has become, if we replace it by, it is a variable, this is variable, this variable we will replace it by Y. Now it has come Y is equal to this variable, substrate concentration is a variable, so we take as Y is equal to A x plus B. This Y is equal to A plus B is nothing but a equation of straight line. No? So if we go on drawing this graph, taking 2-3 samples, say we'll take the sample, then we'll plot here like that. A, B, C. Then we'll draw a line. Okay? So if we extend this line this way and this way, we can extend it. We'll get two intersect in y-axis here and another intersect here. Okay? So there, this is half Vmax. This is half Vmax. And this is one by Km. And as because this is towards the left, it will be minus. Okay? So from this line, we can determine the maximum velocity of the enzyme, because this point we can get the value, whatever the value is, it will be 1 by say 100. So maximum velocity will be 100. Like that, we can determine here Km also. But Km is already known to us. So these are taking three different velocities in different substrate concentration, point A, B, C are plotted and straight line is obtained. Okay? The line intersect Y and X axis, which represent Vmax and Km. Hence, easier to get Vmax and Km of given enzyme. Now, this part you understood, no? You will get short note, Km. So, Km, what is that? You have to read it. Sometimes they give Vmax also. Now, this is a graph produced by change of temperature on effect of temperature on enzyme velocity. So, every enzyme has an optimum temperature in which it acts the best. Okay? So, that is called the optimum temperature for that enzyme. Now, if we go on increasing the temperature, the enzyme activity drops down. Or if we go on decreasing the temperature, the enzyme activity goes down. Okay? So, increase gradually to maximum with rise of temperature, then declines. A bell-shaped curve is observed in this case. Optimum temperature for most of the enzyme is between 35 to 40 degrees. In our body, whatever the enzyme is functioning, its optimum temperature is what? How much? 30? 30? What is the body temperature? 37. Okay. So optimum temperature is 37, but range is 35 to 40. Now there are some enzymes which can function in higher temperature or lower temperature. So DNA tag polymerase is one, then muscle adenylate kinase is another enzyme. They can function at 100 degrees centigrade. And urease have optimum activity at 60 degree centigrade. Now, what is temperature coefficient? You will get short note Q10. Q10 is defined as the increase in enzyme velocity when the temperature is increased by 10 degrees centigrade. 10 degrees centigrade, that is called Q10. Okay? Majority of the enzyme has Q10 of is between majority of the enzyme Q10 is 2 between 0 degree to 40 degree, because this temperature range you have to keep, otherwise enzyme activity will be less or more. So increase in temperature results higher activation energy of the molecule. Means when there is increase in temperature, the molecule will easily get activation energy. It will go in a higher transition state and easily undergo catalysis. So that's why, because of the higher activation energy, the Q10 increases. The higher activation energy is one reason, and another is in increased temperature, the molecules starts colliding each other, as well it collides with the enzyme. So in higher temperature, collision between the enzyme and substrate becomes more. So more amount of substrates come in contact with the enzyme, and there is increase. That's why the increased catalysis of the substrate is increased. Above 50 degrees centigrade, their denaturation occurs, and at 70 degree, enzyme activity is stopped. It becomes inactive. Why? Because it's protein in nature, then denaturation occurs at 50 degree, and at 70 degree, there is coagulation. Keep food in the refrigerator so that it doesn't get rotten. Because of the low temperature, the enzyme produced by the organism cannot ferment food material. Okay, so that's why food can be stored in the refrigerator. Certain operations are done lowering the body temperature, that is by inducing hypothermia, and thus operation is done. How it is done? They decrease the body temperature, and this type of hypothermia is used in case of vascular surgery. Okay. Now, effect of pH, similar to the this one, temperature. It also produces a bell-shaped curve. Here pH, here velocity. Okay. Now, if we go on increasing the pH, there is a optimum pH where the enzyme acts best. Okay. That is called optimum pH for the enzyme. So, if we go on increasing the pH or decreasing the pH, there is gradual reduction of enzyme activity, and at times the enzyme becomes inactive. There is no more function. Okay? Now why? It is because the enzyme has a catalytic site. In last class you might have been told enzyme has a catalytic side where the substrate binds and gets catalyzed. There, the responsible amino acids are acidic amino acids or hydroxyl-containing amino acids. So, with the change of the pH, with the change of pH, uh, the acidic amino acid and hydroxyl amino acid containing amino acid substrate enzyme undergoes change in their velocities, amino acids, velocities of valency of these molecules. No? So that's why there is defect in enzyme substrate binding and there is defect in enzyme catalysis. So enzyme concentration alters ionic change on amino acid, particularly in active site, then substrate and enzyme substrate complex. Okay? So maximum of the enzyme, they act in an optimum pH 6 to 8. What is the body pH? Do you know? It is 7.4. So the range is 6 to 8. Exception is Pepsin. You know what is Pepsin? It is an enzyme of, okay. Now it is present in stomach and stomach has a high hydrochloric acid concentration. The pH is 1 to 2. So in that acidic pH, it can act and it is the 1 to 2 pH is its optimum pH for adequate functioning. Acid phosphatase, it is 4 to 5 pH. Alkaline phosphatase, it acts in alkaline medium, that's why its name. 10 to 11. Enzyme of plant and fungi are active in acidic pH 4 to 6. Now, effect of product concentration. C. When product is more, there is no space to accommodate more product. So, enzyme activity will be reduced. So, accumulation of reaction product decreases enzyme velocity. In certain reactions, product combines with active site of the enzyme. Product itself combines with the active site of the enzyme to form loose complex, thus inhibit enzyme activity. But in living system, the product is immediately removed from the medium so that the enzyme activity can carry on. Effect of activators. Some activators like metal ions, like magnesium, zinc, then manganese, calcium, cobalt, copper, sodium, potassium. These are required for the optimum function of the enzyme. Not all enzymes require all these things. It depends on the enzyme, what activator it needs. Now, sometimes cation, anion is required for the activator, like amylase, it utilizes chloride ion. Metal function as activators of enzyme velocity through various mechanisms. It may combine with the substrate or it may form enzyme-substrate metal complex, or it directly participates in the reaction and bring a conformational change in the enzyme so that optimum enzyme activity takes place. Two categories of enzyme requiring metals for their activity are distinguished. One is metal activated enzyme. That means metal ion is not tightly held by the enzyme and can be exchanged easily with other ions. They need the presence of metal ion, but they are not tightly bound to the enzyme and they can be separated easily. ATPase, then enolase, these are the enzymes require presence of these enzymes. And another is metalloenzyme. Metalloenzymes are the enzymes binds tightly with the metal. That means a metal is a component of enzyme structure. Okay. Now in that case, the metal cannot be separated easily, but they are essential for the enzyme activity. Alcohol dehydrogenase, carbonic anhydrase, alkaline phosphatase, carboxypeptidase, and aldolase, they contain G. Carbonic anhydrase G. You will be asked in Viva, tell one enzyme which contains G, zinc-containing enzyme. Okay, so we usually tell about the carbonic anhydrase because every chapter you will get carbonic anhydrase, so it is very easy to remember. But other enzymes, alcohol dehydrogenase, alkaline phosphatase, carboxypeptidase, they also need G. Phenol oxidase, it needs copper. Pyruvate oxidase, manganese. Xanthine oxidase, molybdenum. Cytochrome oxidase, iron and copper. These are the mechanism of enzyme action. There are 3 theories. So, enzyme decreases activation energy of the reaction. Say this is a substrate which need enzyme action to produce product. Okay. Now to undergo reaction, this substrate has to go here in the form of energy, the activation energy. It has to raise to a certain level so that the reaction can take place. This amount of energy is called activation energy. Activation energy. What does enzyme does? What do enzyme does? It suppose like a tunnel, no, it reduces. It will produce a. It's not tunnel, but it will reduce the energy required for the enzyme substrate to undergo catalysis. So here the substrate will require less energy and it will go this way and produce product. Just for understanding sake. So energy required by the reactant to undergo the reaction is activation energy. There are 3 theories: lock and key model, Fisher's tablet theory, mechanism of enzyme action. What is enzyme? Classify enzyme, describe mechanism of enzyme action, or describe enzyme kinetics. So in that model, what do they say? They say that enzyme has a fixed. Suppose this is enzyme. It is rigid and it has a pre-shaped receptor site where substrate can bind. So what type of substrate can bind? The substrate which is having configuration like that. Can bind to this. Okay? So only this type of substrate can bind and others cannot. Next is induced fit theory of the Covalent model. It is also called Covalent model. Here they don't say that enzyme is rigid. They say that it is in nascent form. This is in nascent form of active site. Substrate binds to the area and produce a conformational change for firm enzyme substrate binding. So the area is not that rigid. When the substrate binds, only conformational change occurs and it tightly binds. Substrate strain theory. Now in this theory, they tell that once the substrate is bound to the enzyme, they produce a strain. See, this is the enzyme, these are the receptor sites, substrate is here, it binds like that. And second type of theory, there is no specific binding site. They bind, the substrate comes and binds here loosely, then conformational change occurs and enzyme assumes the shape of to accommodate the substrate. Now, in third case, the enzyme binds with substrate binds with enzyme and produces strain. Because of this strain, there is the substrate gain activation energy and facilitated a reaction. Now, mechanism of enzyme catalysis. That was the, don't confuse, this is the mechanism of enzyme action, and here is mechanism of enzyme catalysis. Enzyme substrate complex is formed. Now the action will be there on the substrate producing product. How the action occurs? So formation of enzyme substrate complex is crucial for catalysis. Reaction is million times faster when catalyzed by enzyme. Now, one type of catalysis is acid-base catalysis. The most important amino acid present in the active site is histidine. Then other are tyrosine, cysteine, lysine. The enzyme used such type of catalysis are ribonuclease and pepsin. Second, substrate strain. In the mechanism of enzyme action, also substrate strain is there. But in case of enzyme catalysis also, there is substrate strain. Strain raises energy level of the substrate and substrate reaches to the transition state, and there is enzyme reaction occurs. Such enzyme responsible for such type of using such type of catalysis are lysozyme. Covalent catalysis, negatively charged or positively charged group is present at the active site of the enzyme site binding, which help binding of the substrate. And in serine proteases, covalent catalysis and acid-base catalysis occur. Okay, in the active site there is negative charge amino acids are there, and in case of substrate there are positive charge amino acids are there. So due to the negativity opposite charge, they bind in the active site. That's what the covalent catalysis occur. In entropy effect, enzyme enhances reaction rate by decreasing entropy. Higher concentration of substrate increases rate of catalysis when correctly positioned and bound on the enzyme surface. The substrates are strained to transition state. This is called proximity effect. That means there is increased collision between the enzyme and substrate. And when substrate bind, there is a strain produced in the substrate to raise the subject to transition state. And this is the proximity effect. So these are the process by which enzyme catalysis occur. But in case of one reaction, more than one type of reaction processes may take place. Say, in given enzyme, only acid-base catalysis will occur. It may not be like that. So combination of 2 or 3 mechanism may be involved in enzyme catalysis. So you have to read, try to understand the slides. It will become easier. Okay. First, coming to the college, you have known what is these things. Now, What is IMG? So your name has been changed. No? Now we are told as Indian medical graduates. So why do you like to be a doctor? That we have discussed last class also. So for newcomers, why do you like to be a doctor? Anyone? Those who have come in today's class, first time. Any one of you, tell me, why do you like to be a doctor? Tell frankly. Bolo? Why you like to be a doctor? Can I say? So anybody from the whole class? Just give me a point. Why you like to be a doctor? What do you feel yourself? Somebody has come because parents said they have pressurized to be a doctor. No? But anything else other than this? Okay, for me, my dream was to be a doctor. Okay, not for earning money. Because when I saw doctors there in the treating the ailing patient, when I sat as a patient in the chamber of a doctor, I saw he is treating other patients, and some of the patients they tell that that when I see that doctor, I am half you, no? I am half you, half relieved from my agony. So that gave me a boost to be a doctor, and since then I promise I will be a doctor. So what do you think are the privileges and responsibilities of the profession? You can serve the ailing people. You can serve the ailing people. You don't know how much satisfying this is. A patient coming to the OPD with agony of heart attack, agony of pain due to heart attack. There are 4 pains in the, should I say, in human life, which are very agonizing. One is pain of heart attack, myocardial infarction. Another is pain of cholecystitis. Another is pain of pleurisy. You try to take breath, you cannot take breath because of the pain. No? And the last is pain of delivery. These are the tremendous pain that is experienced by the human being. Of course, one for the female. And responsibilities. When you treat the patient, you take the responsibility of the treating the patient, because when you give the medicine, you will think if the patient gets all right, whether he will get all right or not. And if he doesn't get all right, what I will do next? Okay? It is a sense of responsibility that what medicine I have given to him, he should get relief. He should be cured. Okay? This is a sense of responsibility. What do you expect from society and what you think society expects from you? First, we will say society, what does it expect? What do you expect when you carry your nearest one to the hospital? Okay, doctor should come immediately and attend my patient, and my patient should get cured as early as possible. And some of the patients, they want that as soon as the patient comes, my patient should get relief, which is not possible. But it is the expectation of the common people, no? And what do you expect from society? Respect you want. No, you want respect. So somebody getting cured, and while going home, if he or she tells you that, doctor, you have done a lot for me, that is a reward for you. and you will understand that time what is the feeling of that. Until and unless you face this situation, you won't understand. No? So that is the thing which is most satisfying. Of course, money is required. Money is required, but that will not give you that much satisfaction when a patient says, "Doctor, you have done what for you and you saved my life." Okay, that word has a great impact on the doctor. It is not that people do not, nowadays people do not give such type of compliments. Okay, but because of us, because of our attitude, because of our dealing, and because of our inadequate communication between the patient party, the things have been changed. Okay, so the NNC has introduced this ADCOM to regain the attitude of the doctor towards society, and once our attitude is changed, the from opposite side it will automatically change. What you have to do and give up in order to meet your own and society's expectation. Okay, so we have to give a prompt service in a way which is legal, supported by law, and guided by the guideline of Health and Family Welfare of India. So once you follow that, you will be respected. What you should not do, you should not act like a Caesar of the company. That they will make you a Caesar. You cut the pocket of the patient, pour the money in my account, in company's account. Instead of them, what they will do? They will give you some amount of money. And this is being practiced nowadays, and that is bringing the what is that? Wrong misconception about the doctors. So that should not be done. Now, role of an Indian medical graduate, there are 5 roles: clinician, leader, professional, communicator, and lifelong learner. My today's topic is lifelong learner. What does a clinician do? Being a physician, doctor should be able to strive disease prevention, health promotion, cure, pain and distress alleviation, rehabilitation, and palliation. Okay? The person who got accident and lost one limb, and before that he was a dancer. Okay? Now he cannot dance. No? But with the advancement of the medical science, they have created artificial limb. Now with that artificial limb, that person again can dance. No? That is the palliation. Then leader, being a doctor, he should be a member of the healthcare team. He should respect others' opinion, motivate other members of the team. Now, when you become a doctor, you will be posted to a grassroots level institute, primary health center, maximum of you. There you will be having 2-3 sub-centers under you. There in every sub-center there will be 10 to 15 staff, and the PSC will have again 10 to 15 staff. A total of 20 to 25 staffs will be there under you. You will be the leader. Okay? So you have to know the right thing, so that you can guide them, you can train them, you can evaluate their function, their activity, whether they are doing rightly or not. If they don't do rightly, even if you are a best doctor of the state of India, your best service cannot reach to the grassroots level, to the people. If cannot reach, your best service is useless for them. So you have to be a good leader. You have to see whether they are functioning, working adequately, working in a correct way. So you have to supervise them. For supervision, you have to know the thing. a person who do not know the exact, actual thing, the properly, he cannot supervise. No? So you have to know that, and that is the wonder of lifelong learner, because things are changing every day. Professional doctors should obey the prescribed ethical and legal code of conduct in legal practice and be professional. So whatever you practice, that should be legally supported. People are very much conscious now. They will say in the mobile, they will from the net, they will search whether the medicine you have given is correct or not. So any wrong medication, any extra medication, any dose, mistake in dose, you will be caught and may be sued in the court. So that should be legally supported. So if any patient, if he tells that, sir, you have given this medicine, its dose is, I think, a bit more. So will you get angry? You may not. You are not supposed to get angry. Okay? Because you know you have given the right dose. If mistake, you may confuse. But you know you have given the right dose. Why? An anti-aging albendazole is given single dose on first day and repeat dose after 7 days. Now in a patient, the albendazole is given, in some other patient, the albendazole is given 1 tablet TDS, 3 times daily. See, where you give once in a week, now has been given 3 times a day. Okay? Now the person has said, albendazole is being given once in a week, say 1 day, repeat after 7 days. Now the doctor has committed mistake. Now he will come and he will be accompanied the self-declared leaders or his friends, and come to doctor. This medicine you have given is, I think, not correct. They will talk like that. But that time what will you do? Then you have to make them understand, sir, this is usually given once in a week, but I have given you for the disease of cure of tapeworm infestation, and that's why its dose is 1 tablet TDS. Okay? So, like that, you have to defend yourself. So, whatever you prescribe, it should be legally supported and as per guideline. Communicator should effectively communicate with the patient, family, colleagues, community to improve their patient service. So, you have to explain beforehand what you are going to do, what may be the outcome of the patient. The surgeon who is going to operate the patient in the table is explaining the unwanted outcome in the operation table. The patient may anytime die. Okay, in expert hand also, there is a accident on the operation table, at least 1%. So that thing you have to explain. Okay, usually doesn't occur anything, but may occur anytime. So he should be mentally ready. After, if unfortunately anything happens, you will be safe. And other thing, suppose the patient taking drug of tuberculosis, he should take 9 months course. If you don't communicate the thing properly to the patient, to the party, he will stop it after taking 1 month. He will take this. I cannot take, in my lifetime I have not taken any medicine so long time. Now you are telling me I have to take 9 months, and you are going to kill me. So he has to take, no? He has to take. So being a leader, you have to communicate the thing why you want to give. If he is not agree, you have to ask their community leader whom they usually accept. You can take the help of that community leader and convince him. If fail, you can take the patient support group is there. Nowadays, patient support group is every health and wellness center has patient support group. The similar type of disease, a patient recovered from similar type of disease will come to him and tell that, uncle, you take this is a very good drug, and I have taken, I also had, and I got healed. So he is convinced. Okay? So like that, communication, you have to be a good communicator and lifelong learner. You have to keep your knowledge up to date in giving the service and to develop the skill. So clinician, leader, professional, then communicator and lifelong learner. These are the 6 qualities of good doctor. Altruism is doing you will do everything in the interest of patient, not self-interest. Selfless concern for well-being of patient without expectation of reward. Accountability, whatever you prescribe, that should be justified and take responsibility of the action. It will increase doctor-patient trust, prevent misuse of resources, and help providing better health care. Excellence, conscious effort to exceed normal expectation and be committed as lifelong learner. Duty, free acceptance of committed to service, patient care, patient safety, quality service is the first concern of a doctor. Honor and integrity, high standard of behavior and refusal to violate one's personal and professional code. This helps build trust among the party. While you are going to examine a patient, while you are going to touch the patient, tell that I am going to see your abdomen or I am going to auscultate your chest. That is a verbal permission. So without permission, you cannot touch the patient, cannot examine. So that is the thing. Respect for others, respect for the patient, relatives, nurses, students, colleagues is the essence of humankind. You have gone to work and found that one dose of antibiotic is missed for a patient. So if you have to tell something to the nurse, you cannot tell in front of others. You come to the nurse's room or doctor's room, then only you can make her understand. But in front of others, you cannot do. Okay, so we have to respect the others, say relatives, students, colleagues. Okay. Now, today's topic is lifelong learning. This is an operation theatre, long time back. See, the patient is hold his hands and legs and he is being operated. Okay. Now, with the advancement of medical science, the doctor is operating through a operating microscope. The things have been changed enormously. So, you every time should increase your knowledge by reading. So, lifelong learning means striking the right balance between confidence and doubt. Lifelong learning is a process of continuously scrutinizing and building on your practice to be the best doctor you can be. This is a balance between doubt and confidence. Here, there is doubt, confidence is less. Following lifetime learning, you can balance these two. So, the doubt is least and confidence is, there is a proper balance between doubt and confidence. What is lifelong learning? Is the progression and development of human potential by a continuously supportive process which empowers and provides impetus to a person in acquiring knowledge, values, skills, and understanding so as to successfully employ these with confidence and creativity in all arising circumstances and changing environments during course of his her lifetime in the profession she practices. Remember one thing, what your mind does not know, your eyes cannot see. Okay? So you have to know first, you have to study first. Then only, if sometimes a symptom you have not seen, but it appears in the patient, you can identify. But before that, you have to put it, you introduce the thing through lifelong learning to your brain, so that your mind, your eyes can detect it. Process of long learning, this is learning to know, this is the cognitive part. First you will know it. Cognitive part, you will know it. Then learning to do psychomotor part. Once you know, you have known, you can do it. You can do it, and that is the psychomotor part. Learning to work with others, this is the effective aspect. Once you have known, you have learned the thing, and you can do it, you can work with others equally with confidence. And thereby, once you are confident, you can be a good human being. While you can serve with confidence, so you can be a good human being. Qualities of lifelong learner: metacognitive skill, self-directed learning, self-monitoring, reflective behavior. Metacognitive means it is organizing and evaluating through process related to the learning and problem solving. So they have problem solving attitude. Self-directed learning, what do? You should have a motivation to learn. Only then you can go to the self-directed learning. Once you are interested in the thing, the resource of learning you will find out automatically. Okay? So it is self-motivated individual, they can do it, and they take the primary responsibility of planning, continuing, and evaluating learning. This is an individual attempt taken by the person himself. Then self-monitoring. After learning the thing, you will evaluate how much you have learned. What is the low faults? What is the gap? You will identify the gap, and you will bridge the gap by further learning. Reflective behavior. Once you have learned the thing will be expressed in your activity. Ability to reflect oneself to take critical stand. Once the patient is in problem, you can immediately take the action once you know the thing. So they continuously engage in adaptation and learning. Such type of people, they have a drive of self-learning. So they go on studying the thing and learning the thing. Commitment of lifelong learning as an important part of physician's growth. So that you know, already many times you have healthcare being ever more challenging, its complexity. So different problems that arising in the treatment, how it is solved, the updated protocols that you will know by learning only. Patients and their families have expectation for the highest possible quality of care. When they come to you, they take that, my doctor knows the best. Okay? So, actually you have to know the best. You have to equip yourself with knowledge to serve the patient the best. Being an MBBS, you may not do the operation, but you can guide him to go to the right person. Okay? Now, healthcare leadership requires knowledge and competency in stuff like never before. Competency test is essential. That means, suppose under you a ASHA is there, working in the periphery, in the grassroots level, in the village. So she is giving the home-based service to the community. Now you have to see how much competent she is, and for that you have to develop a protocol, some questionnaire, some examination type of things, so that her competencies are evaluated. So like that, your competency will be evaluated by your higher authority. So competency evaluation is necessary, sometimes means at least once in a year, so that you can find out if deficiency is there or not. And if there is deficiency, that can be reached through continuous learning. Government regulations and healthcare needs are continuously changing. Yes, it is continuously changing. There are many government programs which are being given to the community. So every time there is a change. Every time during COVID time, we have seen so many things are. We have never seen a pandemic. We read in the book, but should I say, I am lucky. We are lucky to see COVID. We heard there was a outbreak of diarrhea, cholera. Okay, that was not pandemic, but there was an outbreak. People, what they do? When person started attacked by the cholera, people left them in the home and they left the village. Okay, the person died in the village unattended. So such type of situation is to arise. The same thing we have seen in this COVID, and there was every now and then there was change of guideline, giving the medicine in terms of prevention, in terms of patient care, okay, in terms of safety of doctor. So to keep it up to date, we have to go to lifelong learning. What we did, we used to read at night what are the things they had uploaded. So we have to read it. Otherwise, I have to guide my staff for their safety. I have to guide the doctor, patients for the other patient's safety. Okay, so I have to know it. All the persons of the medical fraternity has to know it, and they are guided adequately, I think, by the health and family welfare. Lifelong learning is mandatory in career advancement requirement. So it is not a choice. Lifelong learning is not a choice. It is obligatory. You have to. How to be a lifelong learner? Learn in workplace, interaction with the other doctors, nurses, and allied professionals of the various level of seniority. Shapes their personal and professional development. Participating fully in the educational activities of the whichever community of practice you are currently working in. Identify their own learning needs and meet those needs at their own pace. So, being a doctor, it is not that we cannot learn from any nurses. Okay? For me, I learned how to give injection from one senior nurse. Okay? Because medical officers were that time not taught how to give injections. Okay? But I was interested. So when I was that time, it was 7 semester system, 6 months semester system. From the 6th semester onwards, we used to have clinical posting. So evening time, we used to have 4 class up to 4 p.m. After 4 p.m., I used to go to that nurse and I used to give injection. So by that, I learned. So there is everywhere when health workers are there, something you may find to learn it, and don't hesitate to pick it up and learn it. Seek input from others. Get feedback directed at the task, process needed to undertake the task, self-regulation in performing the task. Use evidence at point of care. Use the challenges and surprises that they encounter in practice to formulate questions and find valid answers that can then apply to the patient. make sensible decision by combining the best patient-oriented evidences with patient-centered care. Whatever care you give, that should be patient-centered. Okay. Stay on track. Formulate and structure your learning targets and keep track of how well you are meeting them. See, nowadays, different WhatsApp groups are there among the doctors of same discipline. Doctors of same discipline. Through that WhatsApp, they used to communicate with each other. If any doctor is having problem in diagnosing, he upload the thing. A doctor having sonography or doctor, he is having problem in diagnosing something, so he will upload those sonography report to the WhatsApp group. Then from other end, somebody else will read the thing, and if he can diagnose, he will put the comment. So somebody else again, he saw the thing, he thinks that it is something else. So he may put the comment. So in combining those things, a net result you will find. CLEs are there, then online courses are there, YouTube different courses are there, but not in Facebook. In Facebook some fake things are there, no? So don't go to that. So those digital materials you can use. Scope and importance. For intellectual growth, lifelong learning offers individuals the opportunity to keep their knowledge current, learn new skills, and pursue a wide variety of interests through intellectual growth and expansion. For updating recent advances, to stay updated in the most recent evidence, treatment options, pharmaceuticals, and equipment in order to practice medicine and maintain credentialing and practice privileges. See, during our beginning of the career, we saw a medicine, celecoxib, used for the rheumatoid arthritis, celecoxib. Okay. Now, same group etocoxib is there. So, celecoxib, it was widely used. And at times, hello, yes, shall I participate? Shall I participate? What you are doing? थोड़ा तो सुनो ना, you will have a question from here. You will have a question, definitely. Okay. So, see, celecoxib, after a few years, it has been found that celecoxib is nephrotoxic. So, that has been banned. So, if we are not in touch with the medical education, continuing this medical education, we would not have known that and go on prescribing the medicine. So, updates of the medicine and all medical practices, you have to keep up to date. Okay. Now, for updating, for decision making, CLE seminars, conferences, you have to attend. There are new techniques will be described. You will be given hands-on training there in these conferences, and thereby you can increase your skill. For updating person's behavior and personality. On optimizing, person always seeks for knowledge and self-motivated enhances his, her knowledge, skill, and personality traits. Important part of physician growth, learning, lifelong learning as an important part. So, career choice, through this continuous learning cycle, people can provide an expanded contribution to society and extend their options for career choice and life enrichment. For employing the changed dynamics of the patient healthcare. Healthcare is an ever-changing field of practice with advances in medicine, expected evidence source, new treatment options, and changing governmental regulations and models of care. So, government has started a scheme JSSK. Okay, Janani Shishu Suraksha Karyakram. Here, mother and child, they are freely treated. The child will get free treatment for up to 1 year, including conveyance, taking to the hospital and after discharge taking to the home. That the child will get. Mother will get the whole pregnancy period free of cost treatment, investigation, and she will get conveyance for going to the hospital for delivery, and after discharge she will dropping back to the home. Okay, so up to 1 year, all the medicines she also will get free. So these are the things, and this needs, doctor needs to equip him with the updated knowledge. So lifelong learning is not an option or in healthcare. It's required by the healthcare worker to remain relevant, continue providing safe, effective patient care. For updating with changing medical laws and ethics, ethics guidelines in clinical practice are constantly upgraded and amended, and doctor has to know because it is related to his service. Healthcare system is organization of people, institutions and resources that deliver healthcare service to meet the needs of the target population, and the quality service by the healthcare institution is possible only by upgradation and up-to-date knowledge of the doctor. Okay, and that is possible if he is involved in lifelong learning process. This is operation theater with many people, with upgradation of the medical advances, inventions of the different equipments and AI tools. Now they are involved in robotic surgery. Doctor is not there, patient is lying on the bed, operation is being done. Okay, operation is being done by the robot. Of course, robot is run by the human being, the surgeon himself, from a different chamber, different place. Okay, that is called surgeon console. So, in conclusion, lifelong learning helps to gain confidence in practice. Newly gained knowledge and skill is helpful in managing patient. Updated knowledge is supportive of best evidence-based healthcare delivery outcomes. So, here we stop.